Hi, I'm Professor Stephen Touyz. I'm Professor of Clinical Psychology and Honorary Professor in the discipline of Psychiatry at the University of Sydney. I'm also the Executive Chair of the Centre for Eating and Dieting Disorders at the University of Sydney. I've written 5 books and over 200 scientific papers. Most of these have been in the field of eating disorders. 2 of my books have been translated, one into Italian and the other into Japanese. Recently, I've been awarded a leadership award by the prestigious American Academy of Eating Disorders, which is based in the United States. It's an international organization. I'm also a member of the European Eating Disorder Review Scientific Board. I'm a member of the Eating Disorder Research Society and a fellow of the Australian Psychological Society. I'm also one of the foundation members of the Australian Clinical Psychology Association. I've been interested in anorexia nervosa for the past 30 years. My interest first developed whilst an intern at Clinical Psychology intern at Groote Hospital in Cape Town. It was at this very hospital that Christian Barnard, the famous cardiothoracic surgeon, had transplanted the first human heart. There was a lot of optimism at the hospital at the time as to where medical science could go. If you could transplant a human heart, there was almost nothing that medicine could not accomplish. And it was at this very, very time that I saw my first anorexia nervosa patient. This was a 16-year-old girl, very bright, very gifted, very pretty, who was lying in hospital and literally dying from starvation. The psychiatrist asked me to see her and suggested that I could help her to realize that she needed to gain weight, that she was incredibly thin, and that if she continued to do what she would do, she would in fact die. This didn't seem too difficult. She was brilliant, she was clever, she was top of her class, she was pretty, she had parents who were well off, everything seemed to be in her favor. Surely that wouldn't be a difficult thing to do. However, after seeing her several times, I suddenly realized that this was a much more difficult disorder to treat than I'd ever imagined. Each time I thought I was making progress, she became more determined not to gain weight and in fact to lose further weight. And so started my fascination and determination to try and find better and more humane treatments for this debilitating disease. Over the last 30 years, I have studied anorexia nervosa, collaborated on research projects around the world, and treated many, many patients with this disorder. Shortly after qualifying as a clinical psychologist in South Africa, I was invited to take up a position at the Royal Prince Alfred Hospital in Sydney, Australia. Here I joined my colleague, Professor Pierre Beaumont, and assisted him in establishing one of Australia's first public hospital facilities for the treatment of eating disorders, and we also set up Australia's first private hospital facility for the treatment of patients with anorexia nervosa and other eating disorders. I have been involved in the establishment of units and assisted with the establishment of eating disorder units in London in the United Kingdom, as well as assisted with program developments in Canada as well. I have my own private practice in Bondi Junction in Sydney, Australia. I treat patients with all types of eating disorders, anorexia nervosa, bulimia nervosa, binge eating disorder, patients with eating disorder not otherwise specified. I treat patients on an individual basis, and I also work with their families and carers when needed.